Hi, are people already in? We have a different setup. Mac Wellness now has one. Hi, thanks for the wave, so I know what's happening. You guys can all hear me okay? Let's see, we're at 10 o'clock. Got a small number today. That's disappointing. Excited one. I can hear you. Thank you, Pam. Yeah. I wanted to have a big number. Why can't I see my chat? So they are recording it today. I hope they're going to stop it and restart it because that would be odd right now to have me talking to nobody. See, what time is it? 10:01? Should we start? Thank you all for showing up today. Sorry about any of you that were here last week. A lot of technical difficulties, but it's been remedied. Now the Mac has its own wellness Zoom page, so there should be no more issues. And I appreciate, I did send a few to people who did attend my recorded part of my lecture. It turns out that is my first go at it. That wasn't my final. So if you actually want to see the final, you could check it out on my website, drlindsaysnelson.com. But anyways, last week I talked about, so again, for the people that are coming in and for the recording, I am Dr. Lindsay Nelson at the Multnomah Athletic Club, working from home. Actually had a couple of patients today on Zoom, so I'm trying to switch gears now. But last week I talked about depression and negative moods and how it relates to our external environment. And today I really wanted to talk about depression or these negative mood states in general, and how they relate to the majority of the population. You know, depression is the second leading cause of disability globally. 1 in 10 suffer from depression, and of those, 7 to 11% are treated either with just a pharmaceutical, 60 to 70% are treated with a pharmaceutical and with medical intervention from a professional such as, you know, a therapist or psychologist. Women between 40 and 59 have the highest rate of depression, and 25% of them, 1 in 4 reproductive age, are taking antidepressants. I don't want to talk about teens and children today. I think that's a whole nother separate topic, and with their rate of suicide, I think it needs to be a much more sensitive topic. So I really wanted to talk about just most of especially my population that come to see me, of people just coming in to their doctor's office and, you know, talking about low moods. And depression, you know, is a kind of a overarching definition, but, you know, sometimes people are just like, I don't feel as happy as I normally do, or I'm not sleeping as well, or they have the symptoms of depression, but they're not actually using those words. There's a really great book called Anatomy of an Epidemic by Robert Whitaker, and they really, you know, the book's very interesting, but one thing that I really took from it is that they talk about how we're having skyrocketing prescriptions for skyrocketing antidepressant prescribed. Sorry. And we're also seeing skyrocketing depression. And so if we're treating more, but we're still seeing more depression, then there's something that has to be off. And it has been proposed that most standard medical treatments with SSRIs have only an active placebo effect. And we also know that by hap chance that the treatment of inflammatory conditions with agents such as COX-2 inhibitors, people that are on Celebrex, result in remission of depression. So there seems to be a connection between depression and inflammation. The causes of depression are multifaceted. We see genetics, history of abuse, neglect, trauma, medications, PMS, you name it. But the role of nutrition and inflammation is becoming more and more mainstream. It's been in ND's back pockets forever, but it is becoming more and more of a hot topic. This whole monoamine hypothesis, monoamines are your brain neurotransmitters. This hypothesis that those are what are off, like our serotonin, and how they play a critical role in depression is just a hypothesis. And now the validity of it is being questioned. So I propose, as do many others, what if we looked at depression as a model of inflammatory disease? It is interesting that if you look at the symptoms of depression, they look a lot like other inflammatory conditions. Take the flu, for example. We see, body aches or just muscle pain, insomnia, fatigue, lack of appetite, lack of motivation, decreased interest in activity, etc. We know that diet influences our mood states, cause depression by influencing inflammation. We've talked about it, 2-3 weeks ago, I think, where, our GI is a gateway of disease or a gateway of inflammation. We talked about that nutrition plays a role in oxidative stress, neuroplasticity, mitochondrial function, and more importantly, our gut microbiome, we know, are the ones that make our monoamines, our brain neurotransmitters like serotonin and GABA. And study after study, there seems to be diets that keep coming up as the go-to, and that is the Mediterranean diet. They have found that a strict adherence to the Mediterranean diet shows 33% lower risk of or incident of depression. The Mediterranean diet is full of fruits and vegetables, lots and lots of vegetables, nuts, healthy fats that you get from olive oil and fish, low amount of red meat and processed meats, low amount of trans fats, trans fats we get in boxes, and alcohol in moderation. Some MDs that are treating inflammation, like Kelly Brogan, really recommend this kind of high-fat paleo diet. There's small nuances in all of these, but what we're really talking about are diets that are high in good fats, high in vegetables, low in like saturated fats and trans fats. There was a study of 80,000 women, and they found a correlation between flavonoid intake and a lower incidence of depression. Flavonoids, just like your carotenoids, are what give your fruits and vegetables those really bright colors. But they have, and there's, of your flavonoids, there's kind of like subclasses, but they have found the ones that really seem to help with depression are oranges, apples, celery, chocolate, my favorite, and grapes, which yes, does include wine. In a study of almost 6,500 women, an anti-inflammatory diet had a 20% reduction or reduced risk of developing depression. An anti-inflammatory diet is a lot like a Mediterranean diet, a lot like the high-fat paleo diet, limiting your carbs, high vegetables, limiting processed meats. The anti-inflammatory diet is also going to be eliminating dairy and soy and eggs and that type of stuff. But they all have a similarity. Diets rich in omegas show a lower incidence of depression. And where do we get our omegas? From fish, olive oil, that type of stuff. And what essentially is an omega? It's just an anti-inflammatory fat. So if an anti-inflammatory diet reduces the risk, isn't that the same thing as kind of looking at our diet as preventative medicine? And let's go back to the statistics. Who is affected more? And at what age? Right? It's women, and it's happening during times where we're seeing major hormonal shifts. We're seeing it postpartum. We're seeing it at the reproductive age. We're seeing it in menopause. So these hormonal changes, like what we see in menopause, they can modify the levels of monoamines, those brain neurotransmitters, but we can also see an increase in adipose tissue and inflammation. guess where more of those inflammatory cytokines are made? Adipose tissue. So we kind of see this like positive feedback, this feeding of the feeding of inflammation. There are no standardized tests for depression, but I propose we try to look at depression as an inflammatory disease and thus look for sources of inflammation. So tests that I recommend would be a CRP. A CRP is a standardized inflammatory marker. It's seen 41% higher with people with minor or major depressive disorders. We see a 54% increase of interleukin-6 with people with depression. Adipose tissue, fat cells, produce 30% of that interleukin-6. Even when taken into account, people with higher BMIs have higher have higher inflammatory markers as is, we still see those higher CRP and interleukin-6 people even with normal BMIs. It's also interesting to note that a CRP, again, that inflammatory marker, just a level of greater than 1 shows that a patient is less likely to respond to an SSRI. SSRIs are, kind of the standardized treatment for depression. And CRP level greater than 3 correlate with resistant depression. These are when patients have to try different meds again and again and really not seeing any improvement. And they also have found that those higher levels of CRP correspond to higher levels of suicide ideation. So there's definitely a connection between those inflammatory markers and depression. Depression is often accompanied by elevating circulating levels of cortisol and epinephrine. Epinephrine drives interleukin-6, that pro-inflammatory cytokine. And cortisol persistently being in the system. So all those little cortisol bursts, remember, I think we talked about it quite a few weeks back, cortisol is your stress hormone. So having that persistently elevated level of cortisol makes your cells resistant to cortisol, kind of like insulin resistant. So now you have cortisol, but it's not binding to the cells. And cortisols are natural anti-inflammatory. So, whether you're producing it or not, if it's not getting into the cells, then it's not doing its anti-inflammatory effect. So, if researchers are showing an increase in pro-inflammatory cytokines and decreasing cortisol sensitivity, our natural anti-inflammatory, then we're going to see more inflammation and no natural ability to turn it off. If those inflammatory cytokines then cross the blood-brain barrier, they can then influence neurotransmitter metabolism, right? The serotonin, the GABA. They can influence neuroplasticity. That's a hot word that people kind of throw around that I don't think a lot of people understand. It's basically the brain's ability to change with learning, whether like cutting off synapses that we don't use or forming new synapses. It's kind of, the can't teach an old dog new tricks. We want to have a lot of plasticity so that we can teach old dog new tricks. And then neuroendocrine function, it can affect that. That means all those organs that your brain directly influences. So like your adrenals, your sex hormones, estrogen, progesterone because of your ovaries, and your thyroid. We're seeing increase in diagnosis of depression in postpartum and menopause. We're seeing we see depression with thyroid diseases. So then it becomes, what's the chicken or the egg? And do these all feed on each other, right? Is there some underlying depression because of inflammation? And then we have menopause, and now it's like fire feeding fire. Does that make sense? So I believe inflammation is the key to look at, but I'm also going to look at some other markers. So I'm going to try to rule out any underlying disease or conditions such as autoimmune diseases, blood sugar irregularities, nutritional deficiencies. There's plenty of studies that say that have shown B vitamins, especially folic acid and B12 deficiencies, to have influence on depression. We also know that we see improvement when they are medicated with those Bs and folic acid. I do want to just like make a little side note that we're seeing a lot of people who have a genetic mutation that don't allow them to methylate their Bs. Basically, if your Bs aren't methylated, then they're not active. And Bs are essential for mood stability and for reducing the risk of these genetic methylated mutations. The test to look for that, the genetic test, is an MTHFR, and some doctors will run it, some won't. Out of pocket, and it's 130 max, and that might be something that you may want to consider, especially if you're showing signs of B12 or folic acid deficiency. We know that another nutritional deficiency like vitamin D, we see improvement in depression and other brain kind of disorders with vitamin D. Iron, magnesium, these are all important to look at. I would order a full thyroid panel, looking at not only TSH, free T4, free T3, but a reverse T3 and those autoantibodies. I would do a hormone test. I would do an adrenal cortisol test, looking at 6 different points during the day. Our cortisol levels are on a circadian rhythm. They're high in the morning and low at night, so I want to map that out. And I would do a full blood sugar evaluation. Remember, sugar is like adding kerosene to a burning fire. So I want to see what the person's blood sugar levels look like. I'm going to do a hemoglobin A1C, an insulin pre or fasting, and then post a high carbohydrate meal, 2-hour post carbohydrate meal. As far as treatment, there is no single human study confirming the hypothesis that depression is caused by this chemical imbalance in the brain, most notably serotonin. Many studies are showing SSRIs are ineffectual for mild to moderate cases, and the benefits seem to disappear over long-term use. Thus, there's a hypothesis that that initial benefit is more of like this active placebo effect. Did I say what SSRIs are? SSRIs are serotonin reuptake inhibitors, so they're preventing serotonin from being broken down. So one could really argue that the root cause of most depression has not really been identified. And when a patient's coming to see me and complaining about their mood, if there is only a 10% advantage over placebo for treating depression with an SSRI, then the risk to benefit ratio is really not in favor for the majority of patients. And we tend to see with SSRIs, we see relapses for people that are medicated. We see oppositional tolerance, which means they need more drug to see the benefit over time. And that if they do stop, the brain overcorrects and can trigger even more severe symptoms. And thus then it looks like, oh, look, the patient should have never gotten off the drug to begin with. They really need it. So I start with finding the root cause, addressing those, looking for any other and other factors such as, autoimmune disease, hormonal imbalance, that type of stuff. And then start with basic treatment. Adaptogens, those are those herbs that really help balance your adrenals, so really help regulating the cortisol burst. B12, folic acid, magnesium, probiotics, essential fatty acids, or your omegas, which maybe are being supplemented or they're just really going into the diet, looking at the person's diet, making sure it's especially anti-inflammatory for them, but then also maybe, recommending a more Mediterranean diet. Curcumin, there's one study that found curcumin had the same benefit in preventing or reducing depression as Prozac. We're going to work on meditation techniques to positively affect the neuroplasticity. We would probably talk about holistic counseling and identifying the emotions and the physical symptoms that they experience and the connection to kind of underlying faulty belief systems. At the end of the day, what I'm trying to say is there's lots of options, more than just treatment with an antidepressant. So if you are someone who is feeling, low mood, negative mood state, depression or whatnot, I encourage you to really get some more testing done and look at your options before just deciding to go on an SSRI. Thank you, everybody. Does anybody have any questions? We did pretty good on our time today. Anybody? No? Any suggestions for next week? You guys are so quiet today. Do I accidentally have you muted? No? Okay. All right, I'll call it then. Thanks everyone for joining me. I don't know what I'm gonna talk about next week, but we'll figure it out. And again, if you have any questions, oh, I did get a question, yay. No, just a compliment. If you have any questions, please email me, drlindsay.snelson@gmail.com, or you can also catch a copy of this on my website, drlindsay.snelson.com. And I look forward to seeing you guys next week. Thanks.